And welcome back to Body Beautiful. I'm Janelle Marie. We are here with plastic surgeon Dr. Joseph Mealy talking about all kinds of procedures. Doctor, let's answer the question, what is brachioplasty?
Brachioplasty is an arm lift.
Simple enough.
Brachy means arm and plasty means changing. So we're changing the arm, usually tightening it.
Yes, the good old bat wings as we call them, right?
Exactly.
Ugh, love those things. All right, we got lots of pictures about the brachioplasty, so let's get right into it. Picture number one, what's going on here?
So this is someone who came in who'd lost weight, as is usually the case when we're doing brachioplasty, and just has a lot of skin. She has enough skin to cover her arm twice.
I know.
And she just wants once. So what I've done is I've made an incision that goes from the elbow into the axilla, and in this case it goes down the side a little bit so we can raise the axilla along the trunk and also tighten up the skin of the arm.
That's wonderful. So in other words, the scar is underneath the arm and you really can't see it.
So it runs from the inside of the elbow to the sort of the back part of the axilla. So if you raise your arm straight up, you can see it. But in most normal positions with the arm down, it's against the body and difficult to see.
Absolutely, and they do fade. So I mean,
they do.
And
I will see other surgeons will use an incision sort of in that brachial fold, which I think is more on the front of the arm. I think it's more visible, so I tend not to do it that way.
What's the recovery period for the arm lift?
Arm lifts are pretty quick. The hard part is sometimes we'll get a little swelling in the hand, either from tightening the skin or from the garment, and it may take a week or so for that to go away. The good part is, since the incision runs along the arm, raising the arm, moving the arm doesn't do anything to sort of put tension across it. It actually helps bring it together. So movement is allowed.
Picture number two.
So similar story. In her case, the skin goes up a little bit in the armpit, so I don't have to come down the side quite as much. But there's just a lot of skin.
Yeah.
And in this case, it was also heavy. She still had some fat in that skin. That doesn't affect the procedure. So if someone has a little fat in that skin, it just gets removed right along with the skin.
That is great. The after picture looks very natural, and she's got the little curve in there, which looks great as well.
Nice little curve, and then when she stops waving, her arm stops waving too.
So wonderful.
Yeah, she didn't like that. The weight of that movement is uncomfortable, and it's difficult to get into a normal sleeve.
Difficult to wear clothes. I mean, there's a lot of skin there for sure. Let's go to picture number three.
So this is another person with a lot of extra skin on the arm. The incision, again, is placed from elbow to axilla. And I also went down the side a little bit. And what it's done is just tightened up the skin. And you can see sort of underneath my name on the left, there's a little bit of that crepey skin. It's a little irregular.
Oh, yeah.
That all gets tightened up when we tighten the skin. So it really is helpful.
Hey, do men come in for this procedure? Because is it mostly women with the bat wings?
Men come in for this procedure too. It's mostly people who've lost a lot of weight.
Yes.
You know, if someone just has always had a little bit of loose skin, arm lift is probably not going to be a good procedure for them because it is such a large scar.
Right.
And it's going to loosen up a little bit anyway from normal motion. But if someone has that and they have a little fat, sometimes we can just do liposuction.
And, you know, when you gain back weight, are you going to have the procedure again?
Probably not, because the skin that tends to get the biggest, where that fat is stored, is in that area that we're removing. So it's kind of like a tummy tuck. When someone gains weight, they tend to gain it inside their belly rather than in the skin. In this case, we just don't tend to put as much fat there.
Last picture, doctor.
Sure. So similar story. Extra skin. In her case, it extended past the elbow a little bit. So sometimes we'll extend the scar a little bit past the elbow to tighten it all up.
I love it. That's not bad at all. Now, as somebody who has gastric bypass, they're going to do a lot of these surgeries together. So you can do that, right?
Yeah, often I'll do it in combination with a breast lift or sort of breast rejuvenation so we can keep it on the top. And then if they've got something going on in the belly, we can do tummy tuck and thigh lift later if they want to put those together. But any combination is possible, and I always negotiate with my patient in terms of their priorities.
Well, guess what? The time is over. We have to end Body Beautiful, doctor. I hate that. It always goes so fast, right? All right, for more information, just give the doctor a call. It's 925-943-6353, or go to his two websites, drmealy.com or sanfranciscobreast.com, and that is San Francisco all spelled out. Remember, any advice we give you today, consult your physician first. Doctor, it's been a pleasure.
Always a pleasure.
Thank you for having us in your office, and we'll see you next time on Body Beautiful. Bye-bye.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.